Your body is constantly communicating with you in ways that are easy to overlook if you are not paying close attention. It does not suddenly jump from perfect health to illness overnight. Instead, it moves through a series of subtle shifts, quiet signals, and gentle warnings that appear long before anything serious is diagnosed. These signals are not random. They are intelligent responses designed to alert you that something within needs your awareness. One of the most overlooked places where these messages begin to show is in your feet. Think about it. Your feet are the farthest point from your heart, and they rely heavily on proper blood circulation and nerve function to stay healthy. Because of this, even the slightest imbalance in your system often shows up there first. When blood sugar levels begin to rise beyond normal, the body starts to experience stress, and this stress affects the smallest blood vessels and nerves, especially in the extremities. The feet, therefore, become an early indicator, almost like a warning light on a dashboard that turns on before the engine fails. You might feel a tingling sensation, almost like tiny pins and needles. At first, it seems harmless, something temporary that you can ignore. But that sensation is not meaningless. It is a signal that your nerves are being affected. You might also notice numbness, where your feet feel less responsive than usual. This is not just discomfort. It is your body telling you that communication between your brain and your feet is being disrupted. Then there is dryness, skin that becomes unusually rough or cracked. This happens because the nerves that control moisture are not functioning properly. Again, this is not just a cosmetic issue, it is a deeper message about internal imbalance. Small cuts or wounds may take longer to heal, and that delay is another sign that something is not functioning as it should. Your body is essentially saying, pay attention. Something needs to change. The challenge is that most people are conditioned to ignore these early signs. They wait for pain to become unbearable or for a condition to be officially diagnosed before taking action. But by that time, the body has already moved far beyond the initial stage of warning. The whispers have turned into louder signals, and what could have been addressed early now requires more effort and intervention. Awareness changes everything. The moment you begin to observe these small shifts without dismissing them, you move from a state of reaction to a state of control. Instead of being surprised by a diagnosis, you become proactive. You start to understand that your body is not working against you. It is working for you, constantly guiding you toward balance. This perspective transforms the way you approach health. Instead of seeing symptoms as problems to suppress, you begin to see them as information to interpret. Each sensation, each change becomes meaningful. You develop a deeper connection with your body, and that connection allows you to respond intelligently rather than react emotionally. There is also a level of responsibility that comes with this awareness. Once you recognize that your body gives you early signals, you can no longer claim ignorance. You realize that you have the ability to notice, to question, and to act. This does not mean becoming anxious or overly focused on every minor change, but it does mean developing a habit of conscious observation. When you consistently pay attention, patterns begin to emerge. You notice what feels normal and what does not. You recognize when something shifts, even slightly. And that recognition gives you the opportunity to take small, effective steps before the situation escalates. Your body is not trying to confuse you, it is trying to protect you. Every signal it sends is part of a system designed to maintain balance and well-being. The key is to trust that intelligence and to respond with intention. By doing so, you align yourself with the natural process of maintaining health rather than waiting for illness to force your attention. The moment you become aware of something, you step into a completely different position in life. You are no longer reacting blindly, you are observing with intention. Awareness is not just about noticing, it is about understanding that what you notice gives you power. When it comes to your health, especially something as serious as early signs of diabetes, awareness becomes the line that separates control from consequence. Most people move through life on autopilot. They feel a symptom, but they brush it off. They notice a change, but they delay thinking about it. This pattern continues until the body is forced to demand attention in a louder, more disruptive way. But awareness interrupts that pattern. It slows you down just enough to see what is actually happening instead of what you assume is happening. When you begin to pay attention to your body, particularly to subtle changes like those that appear in your feet, you start to gather valuable information. Tingling is no longer just an annoyance. It becomes a signal. Numbness is no longer something to ignore, it becomes a message. Dryness, discomfort, delayed healing, these are no longer isolated issues, They are connected pieces of a larger picture, and once you see that picture clearly, you gain the ability to make informed decisions. Control does not come from force, it comes from clarity. When you are aware, you are clear. You are not guessing, you are not hoping things will improve on their own. You are choosing your next step based on what you understand. This might mean adjusting your daily habits, paying closer attention to your nutrition, increasing physical activity, or seeking professional guidance at the right time instead of the last moment. There is a powerful shift that happens when you move from unconscious living to conscious awareness. Instead of being surprised by outcomes, you begin to influence them. You recognize that small, consistent actions can redirect the course of your health. You stop waiting for a major turning point and start creating one through everyday decisions. Awareness also builds confidence. When you understand what your body is communicating, fear begins to lose its grip. Uncertainty often creates anxiety, but awareness replaces uncertainty with knowledge. You no longer feel helpless because you can see what is happening and why it might be happening. This gives you a sense of stability, even when something is not quite right. At the same time, awareness requires honesty. It asks you to acknowledge what you might have been avoiding. It asks you to confront habits that may not be serving you. This is not always comfortable, but it is necessary, because without that honesty, awareness cannot translate into control. You may see the signs, but if you choose to ignore their meaning, you return to the same cycle of delay and reaction. The beauty of awareness is that it is available to everyone at any moment. It does not require special tools or advanced knowledge to begin. It starts with a simple decision to observe, to question, and to care. Over time, this practice becomes a habit. You become more in tune with your body, more responsive to its needs, and more intentional in your actions. Control, in this sense, is not about perfection. It is about direction. It is about guiding your health in a positive way, even if progress is gradual. Each time you notice something early and respond appropriately, you strengthen your ability to manage your well-being. You build momentum, and that momentum leads to better outcomes. There is also a sense of ownership that comes with awareness. You begin to understand that your health is not entirely dependent on external circumstances. While there are factors beyond your control, there are many that are within your influence. Awareness helps you identify those areas and take responsibility for them in a constructive way. As this mindset develops, you stop seeing health as something fragile or unpredictable. Instead, you begin to see it as something dynamic, something you can actively support and maintain. You recognize that every signal your body sends is an opportunity to adjust, to improve, and to stay ahead of potential problems. This shift in perspective changes how you approach not only symptoms, but your entire lifestyle. You become more attentive, more deliberate, and more engaged in your own well-being. And with that engagement comes a level of control that most people never fully realize, simply because they never pause long enough to become aware. It is often the smallest signals that carry the greatest significance, yet they are the easiest to dismiss. A slight tingling in your feet, a patch of dry skin, a minor cut that takes a little longer to heal. These do not seem urgent. They do not interrupt your day in a dramatic way, and because of that, they rarely command your attention. But what appears small on the surface can reflect something much larger beneath it. The body does not begin with major disruptions. It begins with subtle imbalances that quietly grow over time. The difficulty lies in how the human mind interprets discomfort. If something is not painful enough or inconvenient enough, it is labeled as unimportant. People are conditioned to respond only when the situation becomes serious, when the symptoms are impossible to ignore. Until then, there is a tendency to delay, to rationalize, to assume that everything will correct itself. This is where small signals are underestimated, and this underestimation can lead to significant consequences. Consider how gradual change works. It does not happen in a single moment, it builds slowly, step by step. In the case of developing conditions like diabetes, the body experiences ongoing stress from elevated blood sugar levels. This stress begins to affect circulation and nerve function, especially in the extremities. The feet, being more vulnerable due to their distance from the heart, start to reflect these changes first. What you feel initially is not damage in its final stage. It is the beginning of a process. A slight numbness might indicate that nerve sensitivity is starting to decline. A burning sensation could point to irritation within the nerve pathways. Skin that becomes unusually dry may suggest that the body's ability to regulate moisture is being disrupted. These are not isolated occurrences. They are connected responses to an internal imbalance. Each small signal is part of a pattern, and when viewed together, they tell a story about what is happening beneath the surface. Ignoring these early signs allows the process to continue unchecked. What starts as mild nerve irritation can progress into more severe nerve damage. Reduced sensation can lead to unnoticed injuries, and those injuries, if not properly treated, can become infected. Circulation issues can worsen, slowing the body's ability to heal. Over time, what could have been addressed with simple lifestyle adjustments may require more complex medical intervention. The transition from minor symptoms to major complications is rarely sudden. It is the result of accumulated neglect, of repeated moments where action could have been taken but was postponed. Each time a signal is ignored, the opportunity to intervene early is missed. And as those opportunities pass, the body moves further away from balance. There is a misconception that serious health issues appear without warning, but in reality the warnings are almost always present. They are just subtle enough to be overlooked. This is why understanding the significance of small signals is so important. It changes the way you interpret what your body is telling you. Instead of waiting for intensity, you begin to recognize importance. This shift in perception allows you to respond earlier and more effectively. A small symptom, when acknowledged, can lead to a small action: adjusting diet, increasing physical activity, improving daily habits, or seeking professional advice. These small actions, taken consistently, can prevent the progression of a condition. They can interrupt the cycle before it reaches a critical stage. There is also a compounding effect at play. Just as small signals can build into larger problems, small positive actions can build into significant improvements. The direction depends on your response. If you ignore the signals, the outcome tends to move toward complication. If you respond to them, even in simple ways, the outcome begins to shift towards stability and control. It is not about becoming overly concerned with every minor discomfort, but about developing a sense of awareness that distinguishes between what is normal and what is not. This awareness allows you to catch patterns early, to notice when something persists or changes over time. It encourages you to ask questions instead of making assumptions. Your body operates with precision, and every signal it sends has a purpose. When you start to respect those signals, no matter how small they seem, you align yourself with that precision. You begin to understand that what appears insignificant in the moment can influence your long-term well-being in a profound way. The key is not the size of the signal, but the meaning behind it and your willingness to respond before it grows into something far more difficult to manage. Health is often misunderstood as something that is either present or absent, something you either have or you don't. But in reality, it is shaped continuously by the decisions you make every single day. It is not built in a single moment of motivation, nor is it lost in a single moment of neglect. It is the result of patterns, small, repeated actions that either support your body or slowly work against it. When it comes to conditions like diabetes, this truth becomes even more evident because the body responds directly to how consistently you care for it. Every day presents a series of choices, many of which seem insignificant on their own. What you eat, how active you are, whether you pay attention to physical changes, how you manage stress, how much rest you allow yourself, these decisions may feel routine, but they carry long-term impact. The body does not separate one day from another. It responds to the accumulation of behavior over time. A single unhealthy choice may not cause harm, but repeated without awareness, it begins to shift your internal balance. Prevention is not about drastic measures or extreme discipline. It is about consistency. It is about showing up for your health in small ways again and again until those actions become part of who you are. Checking your feet regularly, noticing changes in sensation or appearance, maintaining hygiene, choosing foods that stabilize blood sugar, staying physically active. These are not complex tasks, but their effectiveness lies in how consistently they are practiced. There's a tendency to wait for a reason before taking action, to delay effort until something feels wrong. But by the time discomfort becomes noticeable, the body has already been under strain. Daily decisions eliminate the need for that urgency. They create a steady state of care where problems are less likely to develop in the first place. Instead of reacting to symptoms, you are maintaining a foundation that supports long-term well-being. This approach requires a shift in mindset. Health is not a temporary project. It is an ongoing process. It is not something you focus on only when convenient or when circumstances demand it. It becomes part of your routine, integrated into your daily life in a way that feels natural rather than forced. The more consistent you are, the less effort it feels like because it becomes habitual. There is also an element of discipline involved, but not in the sense of restriction. It is a form of self-respect. Choosing to care for your body each day is an acknowledgement that your well-being matters. It is a recognition that the quality of your life is influenced by the attention you give to these small, repeated actions. Discipline, in this context, is not about denying yourself, it is about prioritizing what truly supports you. Over time, these daily decisions begin to shape your internal environment. Blood sugar levels become more stable, circulation improves, nerve function is better supported, and the body operates more efficiently. This does not happen overnight, but it does happen reliably when consistency is maintained. The body responds positively to steady care, just as it responds negatively to ongoing neglect. It is also important to understand that inconsistency can interrupt progress. Occasional effort followed by long periods of inattention does not produce the same results as steady, moderate action. The body adapts to patterns, and when those patterns are irregular, it becomes more difficult to maintain balance. This is why daily attention, even in small amounts, is more effective than sporadic bursts of effort. Awareness plays a role here as well. When you are attentive to your daily habits, you are more likely to notice what is working and what is not. You can make adjustments as needed, refining your approach instead of repeating the same actions without reflection. This ongoing awareness keeps your decisions aligned with your goals, allowing you to maintain control over time. There is no single moment where health is secured permanently. It is maintained through repetition, through the quiet discipline of making choices that support your body, even when those choices seem minor. Each day adds to the next, creating either a positive trajectory or a negative one depending on the direction of your actions. By understanding that health is built daily, you remove the pressure of needing immediate perfection and replace it with a commitment to steady improvement. You recognize that every decision matters, not because it changes everything at once, but because it contributes to a larger pattern that defines your overall well-being.